So here I am discuss about axis and plane. The question that is what is axis? So it is line around which movement take place. So we have three axis and three plane. Anterior posterior axis also known as sagittal axis, medial lateral axis that is frontal or coronal axis, and vertical axis. What is plane? So it is the surface on which movement take place. So we have three plane: frontal plane, also known as coronal plane or medial lateral plane, sagittal or anterior posterior plane, and third transverse, or we can say it is horizontal plane. Here, sagittal axis, so the plane is frontal or coronal. Frontal axis, so the plane is sagittal, and axis vertical, so plane is horizontal. So it is opposite to each other. Now here the plane which divides the body. So if sagittal plane, so it divides the body into left and right half. Okay, see in diagram sagittal plane. That means frontal axis thase. So it divides body into right and left. Okay, right and left. The next that is frontal. So frontal plane divides the body into front and back halves. So frontal plane, that means sagittal axis, so it divides body into front and back. And third that is transverse plane, so the axis that is vertical, so it divides the body into top and bottom half. So here a vertical axis which divide into top and bottom. Okay, so the frontal or coronal plane. હવે આપણે movement જોઈએ. So in frontal plane we can say it is sagittal axis, the movement that is adduction, abduction, lateral flexion of trunk, elevation and depression of shoulder, and ulnar and radial deviation at the wrist joint. So here it is hip abduction and adduction, also shoulder abduction, adduction, then ulnar and radial deviation of the wrist, and the lateral flexion of the trunk. Here it is elevation and depression of shoulder girdle. Second plane that is sagittal plane, or we can say it is anterior posterior plane, and medial lateral or frontal axis. So movement that is hyperextension, the flexion, extension, dorsi and plantar flexion of the ankle. See here it is dorsiflexion, that is upward movement of ankle, and plantar flexion, downward movement. The flexion at the shoulder, extension and hyperextension at the shoulder joint. Now third that is transverse plane, so we can say it is axis that is vertical. Transverse plane also known as horizontal plane. Movement that is rotation, supination, pronation, horizontal adduction and abduction. So here it is a horizontal adduction because the movement near to the medial side. Okay, and it is away from the line of the body, so it is abduction, and it is a near to the body line, so it is adduction. So horizontal adduction and abduction, supination and pronation. So these are the movement which take place into a transverse plane, or it is a vertical axis. Thank you.